Between the wildfires in Southern California and the flash flooding at Camp Mystic in Texas, America has experienced truly devastating weather events this year. But even though we see some of these extreme incidents every year, Alexis Merdjanoff says that oftentimes local and state officials are still unprepared when tragedy strikes. She feels this disconnect stems from a sense of disbelief that such destruction would actually happen in their area.
It's one of those things where people think, oh, it could happen to you, but it's not going to happen to me. And that is a very dangerous place to exist. It's also something that I think that we do for ourselves to offer some sort of mental health protection, because we can't be walking around thinking all day, every day, what's the worst case scenario that's going to happen.
But we do need people in place who are dedicated to preparing for tragedy. Merdjanoff is an assistant professor of social and behavioral sciences at New York University's School of Global Public Health. She specializes in how natural hazards affect the health of communities and says that we can see this ignorance unfortunately play out with the flooding in Texas earlier this year.
That's an area that floods frequently. People perhaps became complacent that the flooding occurs, but nobody thinks it's going to be that bad. And it happens in Florida. We get hurricanes all the time. I've lived through a ton of them. It's never going to be that bad or the one. But then the one happens. And so I think that is the disconnect, is that people understand that this is a possibility, but they're not preparing for worst case scenario.
America does have national guidelines that discuss 5 factors, including prevention, protection, mitigation, response, and recovery. However, Merdjanoff says there isn't the same comprehensive framework that targets mental health recovery.
Disaster recovery often uses what some researchers call as fantasy documents. We have plans, we know what we're supposed to do. People put in a lot of work to coming up with different programs, stages, but when it actually comes to the disaster itself, those plans can kind of be shelved or put in a drawer and not really referenced.
Or if they are, it's very possible the plans are out of date.
One of the challenges is that disasters, we don't know when they're coming, right? So sometimes we might plan for the next pandemic, but then the next pandemic doesn't come for 10, 15 years, and the plans are outdated.
The good news is that Merdjanoff and other researchers have been analyzing past disasters to see where mental health recovery programs can be better. One tactic she's happy to see being utilized is having open communication between states to workshop the most effective approach together.
So I'll give an example from Hurricane Sandy, which I think was an excellent thing that a lot of the state health officials did. Was they said, okay, our state is dealing with a disaster that's unprecedented. We haven't experienced this in New Jersey before. It wasn't that long after Katrina. And so what they did was they went to officials in Louisiana and Mississippi who had dealt with Katrina recovery and said, what do you think our population might need? And to hear that from people who had already lived through it and could say, hey, this is what worked. This is what didn't work. This is what we should have done. Here were some of the gaps. And then the New Jersey officials could come together and say, okay, this is what we know. And we know our population and who we need to be serving. And these are the kinds of programs that we need to put in place.
And though they worked hard to provide effective mental health programs, Merdjanoff says one of the biggest challenges is timing. Oftentimes, people aren't ready to address their internal struggles until well after the rest of their lives are put back together after a disaster.
They will initially try to get housing, try to make sure their kids are in school. If they're looking for employment, if they need to maintain employment, right? They're dealing with those more immediate needs. And then maybe 3 months, 6 months, a year later, when they're sitting in some relative normalcy, they'll say, oh my gosh, I'm actually experiencing some sort of anxiety. I'm a little depressed. I'm not sleeping well. And they need those services, but all the programming has come to an end.
She says that in many recovery cases, the funding is set up to provide all services up front. However, she argues that the mental health services need to be restructured to be available when the community actually needs them.
A lot of it is set up for that 3 to 6 month period after an event occurs. And if I have learned anything over researching these events the last 15 years, is that that is not sufficient. We need programming that can last for years, essentially. It could be that people only need help for a few weeks. They could need help for a few months, but it could be a year or two or three. And it depends, again, on the severity of the event, the type of event, where it occurs. But a lot of these recovery programs are kind of front-loaded to immediately following a disaster.
Unfortunately, the physical and mental recovery takes a long time. It's an ongoing process that works at its own pace. Because of this, Merdjanoff believes that if there's only enough funding for a few months of mental health programming, they should start later in the revival process, depending on the community's needs.
An event where people are trying to get their housing together, they're trying to get their kids in school, regain some sense of normalcy, and then it's, oh, I need to tend to myself and my mental health. And that is way further down the line. So if we know that that's the case, can we push the mental health recovery programming maybe 6 months out if we don't have sufficient funds to let those programs run for a year or two?
Having good mental health is such an important aspect of resiliency. In Merdjanoff's research, she's seen how populations with high resiliency tend to recover faster and come back stronger as a group.
And we've seen that a lot with Katrina, with Sandy, when you're thinking about communities that were able to recover at a faster rate. It's because they had this social cohesion in place.
But in order to have this strength in the face of tragedy, she says that it needs to be fostered before disaster even occurs.
And by that, I mean strengthening ties and cohesion among community members so that when a disaster happens, people already have relationships in place that they can turn to when it comes to recovery. A lot of the knowledge that you need in order to recover, whether it's figuring out how to deal with insurance providers, knowing where to get hot meals, finding out that you're maybe eligible for some program that you hadn't heard about. That's a lot of informal knowledge sharing. And you get that from other people who are going through the same disaster.
Merdjanoff says this strong community can be achieved through investing in social infrastructure, like libraries and organizations where people can meet each other.
Doing that ahead of time, investing in that way, which may not necessarily be tagged as disaster preparedness, it's really community building, but it serves multiple purposes. And I think the return on investment is pretty good because it helps not only with recovery, but it helps with health. It helps with mental well-being. It helps with knowledge sharing. And people are happier when they're actually out interacting with each other. So I would like to see greater funding given to social infrastructure. I'm not saying don't invest in physical infrastructure, but can we put a little bit more into the social side of things where we know long-term that there are really high payoffs?
You can find more information about Alexis Merdjanoff and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health on Instagram, Facebook, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.